thank you. I think it's nice that we can start, but I have to say that PanCare is so exceptional because we were able to get so many European funding grants and grants funded. And that's important because that was for all of us the start of good research and working together. And so I think the combination of research and care is really successful in PanCare. And I think Helena and I also have the feeling that that was also successful in our country, because then you can show what you are doing. And that was also what Lorna did. And if you present things and conclusions, that's really helpful. We would like to present now the third project of PanCare, and that's Pancare FollowUp. That was a project that was set up some years ago, and I remember we had a PanCare meeting and we were discussing the call. So the EU was sending out a call and was asking who would like to do something, and if you have a good idea, send the grant and now try to get the money. And then we discussed it, and there was a lot of discussion. And then one of our main persons within PanCare said, and that was Julie, you will see her later on, I hope. And she said, okay, I would like to do something for care. We really have to improve the care. So not only research, but we have to improve the care in Europe. And that was the starting point of PanCare FollowUp. And it was from the beginning a very productive, stimulating, inspiring, and innovative collaboration, I think. What we will do now is that I will present the overview, and I'm the coordinator of this project, and Helene will present one of the work packages. And we choose to present that work package because that's the backbone of everything and the backbone for care, and it can be used by everyone. Oh. I have the same problem that I cannot find my, go away. Yes. So PanCare is a collaboration of 10 European countries. So you have people from 10 countries, and it can be 1 or 2, but 10 institutes in 10 countries who are collaborating together. And what we did, we made a combination of countries from the north, the south, the west, and the east of Europe. And we also took a look to the different levels of care, so that we could improve all different levels of care. So we have something that's in the north of Europe, Sweden. They had already a lot of care, and Italy, and but so we made a choice for everything. And why did we design this big grant? Because we have 300,000 survivors of childhood cancer in Europe. And we know already that 75% of the survivors have 1 or more late effects. But what we also did was a questionnaire in our consortium, and we saw that only a low number of countries organize the care for adult survivors. And so the goal of our grant was to improve the care for adult survivors in Europe. And what we did is we designed 2 prospective studies. And the first one is the PanCare FollowUp Care Intervention Study. And the other one is the Lifestyle Intervention Study. And I will tell some background for both of them. First of all, if you make a European grant, I think we all learned a lot about it, because you can you make different work packages, and then you can make clear who is leading what and what are the different tasks in every work package, and more important, what are the outcomes, what do you have to achieve to be happy at the end of the grant. These grants will get a lot of money. I think the PanCare grants are between 4 million and 6 million euros, so that's a lot of money. But you really needed to work together in Europe and to divide all the work. So the first work package was focused on the development of the care intervention. That's finalized, so Helene will tell us something about it. Then we have the cohort study conduct, and also the cohort study and asking patients and including patients. That's led by Lars. We had somebody who was thinking about the database, the methodology, the analysis. That's done by Jeanette Valk-Winter in Copenhagen. We also include the survivorship passport, and Ricardo and SIOP are working on the preparation for an app for the survivorship passport. We have the e-health lifestyle intervention that's only done in the Netherlands by Jacqueline Lone and Saskia Pluim. And then we have the communication and dissemination, that's Pancare, and management and the ethics, that's done by Bruno colleagues. What I told you already, these are the partners. So also Pencare and CCI for the survivors and SIOP are involved. And we have a partner who is doing all the administration, and that's Pintail, and that's really crucial in our project. So first of all, the Pencare follow-up intervention. So the Pencare follow-up intervention is a summary of person-centered care guidelines and then the information for survivors and healthcare professionals. We made also a short video. You can find it at the Pencare website, and these are some pictures from there. So for the Pencare follow-up intervention, we will start with a survivorship questionnaire. Then we will also make the treatment summary, include already the guidelines, and that will be the preparation before the visit. Then survivors will be asked to the clinical visit, the diagnostic tests will be done, and there will be a consultation with a specialist if needed. And finally, everyone will get a survivorship care plan. Because the whole thought of the care is simple if you see this, but it's really complex. And I have to tell you that even in the Princess Maxima Center, you think that's all optimal, but that's not true, because survivors have no survivorship care plan at the moment. So they will get some information from the healthcare professionals, but it's not computerized or something like that. So we are working on that also. For this study, we thought to have the different countries from different health systems. So we have Brno, Italy, Belgium, and Sweden. And for example, in Belgium, no survivors were invited for the outpatient clinic yet. So that's a really new clinic. Sweden did it already, but it was not that well organized for adult patients. The same is true for Brno, and Italy is also implementing the SURPASS tool. Helena will tell us more about all the tools that are developed already within this project. So the first one is the Pancreatic follow-up guidelines and recommendations. You heard already about it. Everyone can use it already in Europe, so that's important for care. Then we have the survivorship questionnaire that's also published now and in the public domain, so everyone can use it for care. That's the questionnaire that will be sent before the visit to the survivors. Please, if you need a translation, we have already translations in the languages that are participating in the study, so ask us for that. Then we developed the outline for the treatment summary. So for everyone who is not able yet to participate in SURPASS, you can use the treatment summary, and we designed an outline for the survivorship care plan that also can be filled in paper, but Helene will tell us more about this. For the Pancreatic follow-up intervention, we will have some measurements. The first one is the effect of the intervention. The main outcome is then empowerment. So that will be a very important outcome for the study. We will look at the costs. We will look to the visibility in the different centers, and especially also to SURPASS. The second intervention is about lifestyle. Because the Netherlands already organized the care for adult patients, we thought it's good to do another intervention in the Netherlands, and that's an e-health lifestyle intervention, because prevention is also a very important part of survivorship care. So what we did here, we designed a prospective cohort study of 60 survivors. We developed a personalized e-health lifestyle intervention, and we are also improving the lifestyle by empowerment of the survivors. And it's a nice study because it's not that straightforward, because survivors have to define their own personal goal. So that will be the main outcome of the study. So some of them would like to move more, other ones would like to lose some weight. Now we can think about different goals, and then we will look if that's possible. So for the intervention, we did some work. We did a literature review to look to the evidence about the interventions, developed the protocols. We did focus groups and interviews with providers and survivors. And that study will be published by Helena very soon. Now we will develop the lifestyle guideline, and it's nice because both centers have now a lifestyle coach that can coach the survivors online. At the moment, we are in the fourth year of the grant, and all the interventions have been started. It's going very well. We had some delay because of COVID, and also because the start of a study is always asking more work, but everyone is working really hard, and it seems that we will finish everything in time. And that would be great because the European Union will not accept any delay. So we have to be in time, but it was a lot of work. And that's also clear for everyone that setting up a clinic, performing the care is not that easy. Doing research is also not easy, so evaluating the care, but also organizing everything, the logistics, it took us a lot of work. And it will be nice because at the end of the study, we will also share all our results about implementing care, setting up such a study, and what we learned from that. And finally, the most important item is that these interventions will help to improve the care for survivors in Europe. And for everyone who is thinking, I would like to have something about the tools, I would like to know more, please listen to Helene, because she will be the next speaker. Gaat het lukken?
Sorry, I'm just managing two things at the same time. So where am I? Oh, this is the right one. Yeah. So here I will start again. And try to tell you about to go in depth at the Panca follow-up care intervention. So this is the slide Leontine already showed you. This is a little bit more easy to understand and represents maybe the slide you saw before from the maxima, so the flow of life, I would say. So if you look at the Panca follow-up care intervention, you first here have a survivor who is not yet at a clinic. So then you will make a treatment summary, and you have the Panca follow-up recommendation. So you can make a standard survivorship care plan based on the treatment summary. But you don't know anything yet about the survivor or about the medical problems or whatever. So we will send a survivorship questionnaire prior to the clinic visits, and we can make a draft individualized survivorship care plan. Then you will have the long-term follow-up clinic visit with all the tests that are advised by the recommendations. And then at the end, after the clinic visit and follow-up call and maybe some possible additional tests, you can make an individualized survivorship care plan. And this will go on, this process can go on for the rest of the life, because you will start here again, right? Not with the standard, but with the revised individualized care plan. But for this, to be able to do this, you need a lot of tools. And that's what we developed within the Panca follow-up care intervention. So you need recommendations, you need the survivorship questionnaire, you need a treatment summary, survivorship care plan, and also very important, you need information. So for the Panca follow-up guidelines, you already heard yesterday a lot about making guidelines. So I won't tell that again, but they are evidence-based, risk-based, and risk-stratified surveillance, and they are developed by IGHG and Pencare, and they are the cornerstone of our Pencare follow-up care intervention. And of course, the goal is to improve long-term health outcomes by early detection and appropriate management of late adverse effects. So what did we do in Pencare follow-up? We had 2 methods. Because we used the IGHG guidelines that were already there, but based on the Delphi done a long time ago by Renee Mulder, we knew what other topics we needed to address to have a full set of guidelines. And we decided to do a consensus-based recommendation method, because if you go for a full IGHG, that takes 2 years and a lot of people. So what did we do? We compared the existing recommendations from the COG, UK, the SIGN, and our own Dutch guidelines. Plus we used information that was already there for not published but ongoing IGHG guidelines. And we formulated the first draft by the Panca follow-up core group. And then we had face-to-face guideline workshop to discuss the remaining and complex topics. And in the end, the whole consortium agreed on final recommendations, and they were sent out for review. So this is the figure depicting that we thought we needed 55 long-term follow-up recommendations. There were 16 published guidelines. So we had 39 remaining topics, and we shifted them around a little bit. So in the end, we had 25 recommendations that needed to be developed. And that's what we did. And we ended up with 41 Panca follow-up recommendations. It says unpublished, but it's published, and I will give you the links later. So 41 Panca follow-up guidelines. Ricardo already showed a slide yesterday of all the topics, and we have awareness only guidelines. We have awareness guidelines where you also do a history or a physical examination, and we have awareness guidelines who also include a possible surveillance test. So this is an example of a guideline. This is how they look. We will have a few questions like you have learned yesterday. Who's at risk, for instance, for ear problems? What ear problems might occur? What surveillance modalities should be used and at what frequency it should be performed? And the other one is what should be done if abnormalities, or what could be done when abnormalities are defined. So that is in every guideline, like it is in the IGHG guidelines. So the next thing we had to develop was the Panca follow-up survivorship questionnaire. The questionnaire you send out to the survivor before the visit. So the pre-visit preparation to make the first survivorship care plan. So this includes self-reported physical outcomes, self-reported symptoms, and also psychological outcomes. We ask for a medical history, including, for instance, hospital admissions, family history. We ask about health, behavior, lifestyle, and we also ask, and this is very important because that's the cornerstone of shared decision making, we ask about the preferences of the survivor, and if they have questions or anything. So this is a long list, but it has eight domains. But this one, the last one, is really important. How did we make this? We identified existing survivorship questionnaires, and we compared the outcomes of the existing questionnaires. We had an input from our Pancreatic FollowUp consortium through a Delphi method to see what was missing or what was most important. Of course, we had the input from survivors because that's all that is. They are a full partner in care and in Pancreatic FollowUp. We made a draft, and it was finalized through consultation of healthcare professionals, researchers, and survivors. And it is published. It's also in the public domain, and you can find it as an appendix to one of the articles. We have a male and a female version, and it's free to use if you want. So the Pancreatic FollowUp treatment summary. I will not tell a lot about this because the survivorship passport, the content of the survivorship passport and the digital surpass, which is the same, the content is the same. In the Pancreatic FollowUp, in 3 clinics, we use the paper-based version of the treatment summary, and in Italy, they will use the digital version of the survivorship passport, but they have the same content. And the same is true for the survivorship care plan. So the survivorship care plan has general information. It has the treatment summary. It will include health problems, either during treatment or current health problems. Will include family history if necessary, and it will include the guideline-based recommendations for follow-up care. And Ricardo yesterday already showed you what this looks like. So the content paper of the paper-based Pancreatic FollowUp survivorship care plan is comparable to the content of the digital surpass version 1.2. And this is how it will look if you have printed it. This is of course unreadable, but it is attached as an appendix to one of the articles if you want to have a look. So then this is also something that's close to my heart, and that's the plain information. And this is a combination of a Pancare group that was already there, that had the wish to translate the IGHD guidelines into plain information. And we have joined forces with task 4.2 from Pancare FollowUp to translate all the recommendations to brochures for survivors that are person-centered, lay language, accessible, international, and navigable. So that's the plain language. And I have to say, one of the leading PhDs in this is Helena van der Oever. She's not here today, but she's the driving force behind us. And we are a group of about 20 people, including Emma, Potter, and Ricardo. So we have healthcare professionals, we have nurses, and we have survivors. And we try to make the information as accessible as possible. So we try to translate 41 recommendations into 45. Yeah, 41 is, well, it's, well, we will go beyond that into lay language brochures. And why do we do that? We want to empower survivors because information is power. And we want also to provide a bridge between survivors and the healthcare professionals. We want to increase awareness and understanding for GPs and non-cancer specialists. They can also use these brochures. It's also important to increase the visibility and the utility of the Pancare FollowUp guidelines. And they will be freely available in English on the Pancare website and the Pancare FollowUp website. And of course, we want to make them available in all languages, but making them available in English is already a huge task. And they are incorporated, or they will be incorporated in the survivorship passport and especially in the Pancreatic Surpass project, which you will hear about later. So in summary, Pancreatic FollowUp is a multidisciplinary guideline-based follow-up care program to preserve health and quality of life, and to improve life, to really make this flow of life to life with cancer to life after cancer available for everybody, at least to have the tools to set it up. These are the papers that are already published. They're all published in the European Journal of Cancer. And Rebecca van Kalsbeek, she is our PhD, who's the first author. She's done a lot of work, and all the you can also go to the Pencare website to find these. So we do hope, I will not hope, we know that we will improve the care and provide the tools so that everybody can have the survivorship care they want and need. And if you want to be involved, please contact us. Thank you very much.